For people who don't know, you have been very vocal about your concerns with the current vaccine rollout in Ontario, concerned that it disadvantages people of color, people who essentially don't have the kind of jobs that allow them to work from home. And now this news, a 13-year-old girl losing her life in one of the hardest hit communities of Ontario. What went through your mind when you heard the news?
It's just heartbreak. And I don't know how much more we in the health system can stand. When you think of, none of us can imagine what Mr. Villegas had to go through, what Emily's family is going through right now. And the most terrible part is that we're seeing deaths play out every day. And we know that we're not doing enough to protect the people who need it most. And I just can't imagine what is happening. I don't know what we can say to Mr. Villegas. I don't know what you say to a family that we have, from a policy level, betrayed at each step of this pandemic.
Betrayed at each step. And you actually also used words this weekend calling the current vaccine rollout systemic discrimination in motion. So talk to us about why you're using these words and how you're reaching these conclusions.
Michael, because this is the data. This is the evidence that we're seeing. This is not opinion. This is not to push an agenda. This is what we're seeing with our public health data, that through every wave, 80% of the cases are happening in communities of color, in racialized neighborhoods, in low-income households. We're seeing racialized groups having 3 to 4 times higher rates of hospitalizations, of deaths. We're seeing what played out in the long-term care homes of discriminating against our elders and our seniors, against people living in poverty, who are surviving homelessness, and the 5 to 10 to 20 times higher rates of hospitalizations and deaths. And so when you look at each step and you take a public health analysis as to what we have allowed to happen, you do not need to look to the United States to find injustice in this pandemic, to find inequity. We are seeing it play out in the neighborhoods that are on fire and need help, and they have been neglected, and willfully, because no policymaker can say that they have not seen this data that has not been out there. And when you then see and you hear and you feel these stories of the families that now have to have unimaginable pain, and we've known about this data and we've not acted, please tell me what else this is rather than systemic discrimination, when this is clear and the data is clear and the actions are absent.
What are you hearing right now from the people that you are speaking with in these affected communities? What are you hearing from patients, from patient families, about how they are feeling in this moment, given what they are facing in this third wave and the kind of support that they are getting, perhaps not getting, from officials?
I mean, firstly, Michael, it has to be said that communities have incredible strength and resilience. Our communities have shown the strength and innovation throughout this pandemic. We saw this play out with testing, with efforts that have been out there to provide supports. So there is an abundance of strength. But what is very clear from communities, what has been clear pre-pandemic in the social inequities that we've allowed to play out, and what has been widened and ripped right back, the curtain has been ripped right back on the inequities, is that we are underfunding, we are under-supporting, and we are neglecting communities. And the people who have been providing work and supports for everyone else throughout this pandemic. And I think that, to me, adds to the heartbreak. It adds to how cruel these measures have been, because it has been fine to label people essential workers in some of these communities, but seemingly okay to deny them human rights and to put corporate interests over human life. And so you hear it in the lineups, you hear it in vaccine clinics, you hear it in primary care clinics and in the hospitals. People have been feeling left for dead, but they are doing everything they can to survive, everything they can do to protect and support one another. And we have to provide more supports. The fact that we still are saying only a quarter of the vaccine supply is going to go to the neighborhoods on fire, Again, if you looked at that as any other tragedy that was playing out, it would be systemic discrimination to say we will not send the vaccines and supports to neighborhoods on fire. We will send them to the neighborhoods that are not on fire. And that is, again, the data, the public health policies that we are choosing, that governments are putting into place, and that are just compounding the hurt in our neighborhoods.
How can the government do better here? We're now talking about a 13-year-old girl losing her life, and she just is an example of the pain and the struggle people are going through right now. So how can the government do better? What are the immediate shortfalls you'd like to address here?
The roadmap for action has been there. The science table has laid out very strong recommendations about ensuring that workplaces are safer. We again have continued to see some shirking on paid sick leave that, again, we know with the Villegas family's involvement in essential work has put them in an impossible decision and now in an impossible scenario of pain. We also know that the vaccines continue to not be allocated to where they need to be. And I would even push further, again, than the recommendations from the science table, and to say how long, the question to everyone in the province, in our country, is by not ensuring that we are prioritizing the vaccines to the neighborhoods that need it most, that have been under fire, how long are we willing to accept deaths that have played out like yesterday to continue? And that, to me, is what we wake up every day with. And every day that we don't see the public policy action on the recommendations to save lives is what we are accepting as a society.